I'm going to welcome Courtney Baltiski, who's the Vice President for Public Policy for the YMCA of San Diego County. She's our moderator today, and I'm going to allow her to welcome everyone properly and begin. Oh, Courtney, I'm going to ask you to unmute yourself.
You're good. Hello, and thank you, Rachel and the Resource Media team for convening us all. My name is Courtney Baltiski, and yes, I am the Vice President of Public Policy with the YMCA of San Diego County, and here with you all today as one of the facilitators of the Tijuana River Coalition. I'm honored to do this work in connection and convening for this critical issue alongside Sarah Davidson from the Surfrider Foundation and the Clean Border Water Now initiative, as well as Tiffany Curry with Outdoor Outreach. We're all grateful that you made the time to be here today. We have so many incredible partners and media allies who we see on the briefing. Thank you so much to folks from the Coastal Commission, our nonprofit partners, the IBWC, PFAA. We've got both Doctors Granados and Prather in the Zoom room, friends. So grateful for everybody who's taking the time, and so many subject matter experts are here among us today. So if you want to populate the Q&A, we'll definitely have time during the webinar to answer your questions and make sure to tap some of our subject matter experts who have deep knowledge on this critical issue. As so many folks know, this is one of the longest standing public health issues facing the United States. It is a unique issue because it's on the border between Mexico and the United States, in a place with thriving commerce and extremely unique ecological, dynamic, natural resources. But we know that the threat to our communities is dire, and it's worse than ever before. So at the Tijuana River Coalition, we help convene over 65 partners from nonprofit organizations, public entities, to all work towards sustainable solutions for the pollution crisis through advocacy on a federal, state, and local levels. And that's right, I said statewide. We are coming to you today from South Bay area. I'm in Chula Vista here. A number of folks are coming to you from Nestor, San Ysidro, Imperial Beach, impacted communities by the pollution crisis. But this is a statewide issue, and that is what we're here to talk about today. The policy and budget ramifications that are currently being discussed in Sacramento, and the tremendous impact that they will have on our communities. The Tijuana River Coalition often does our work within 5 main areas of impact, and that includes ecological impacts, equitable access to the outdoors, the public health crisis, national security and military readiness, and economics. And we know that affordability is the hottest topic of conversation in San Diego, in California, in our country right now. And the pollution crisis is absolutely contingent on affordability and the economics. At this point, the pollution crisis is impacting small businesses significantly in the impacted areas. Currently, the County of San Diego is conducting an in-depth economic study, but we do have preliminary data from a 2023 study between the County of San Diego and the Chamber of Commerce. And this reported that 74% of local businesses are negatively impacted. 50% have lost significant revenue, which is over $100K a year. 30% have had to lay off staff. Also thinking about the economic impact and affordability, folks who are living in these impacted communities may not have the capacity to change residencies, to move out of the impacted communities. They're also paying higher costs for healthcare and access to doctors and medication they need when impacted by the hydrogen sulfide levels, which we'll talk about, as well as the other aerosolized toxins, uh, soil and water pollution. So we know that the California coast really has no borders. If one beach, child, or community is unsafe from this toxic pollution, no community is safe. State lawmakers have an opportunity to act now in this legislative and budget cycle. And California's commitment is huge. We want to acknowledge laws that have been passed. We've done tremendous work thanks to our state legislative champions, who we'll be recognizing later in the program today. We have secured funding from Proposition 4 with $46 million coming to projects to ease the impact of the pollution crisis. And multiple bills have been passed just in the last couple years. But there's more to be done, and we'll talk you through those specifics today. But we also want to make sure that everybody understands the impact that community members are going through on a daily basis. I'm here as an aspiring ally to them, and it's really a privilege to be able to introduce you to Virginia Castellanos. And Virginia is an RN, she is a nurse with the South Bay School District. She's here today to talk about what she, students, and families in her school district are experiencing.
Hi there. Thank you so much for having me. As Courtney mentioned, my name is Virginia Castellanos. I am a school nurse here at South Bay School District. I'm also a mother and someone who was born and raised here in South Bay. I attended a school here at Nestor Elementary as a child. So this community is deeply personal to me. So the situation that's going on, it's very personal. Now that I'm a school nurse for the district, I've seen firsthand how this pollution crisis is impacting our children, our families, every single day. For example, the alerts that we're getting then prompt the district to then have the children indoors when the air quality reaches a certain criteria. And so we do follow the guidance. And so this is then impacting the students in a way where they're losing opportunities for outdoor play, recess, PE, walking field trips because of the air quality is unsafe. Sorry, we're having a drill. Children, they should not have to stay indoors because the air that they're breathing can make them sick, right? And so some of the impacts that I've seen for us, the children here, obviously asthma is already one of the most common chronic illnesses affecting children. And I did find a study, I found two research studies from the EPA that show that air quality, so air pollution can change how a child's immune system functions. And it did show that it increases inflammation in the lungs and it can trigger and worsen their asthma symptoms. Another study that I found from Stanford University found that children that were exposed to higher levels of pollution did show some genetic changes that are linked to asthma. And it did help them explain why the children that were living in polluted communities are experiencing these serious breathing problems. So this should be a concern and alarming for us here in IB because we do have children who are asthmatics. I myself have a child who is an asthmatic. And so that, like I said, it is a personal impact as well for me. My child, she was diagnosed with asthma 3 years ago. And since then, her asthma has gone worse. She did develop pneumonia every single year, the last 3 years. And it is secondary, obviously, a complication to her asthma. Her doctors do believe that the asthma symptoms that she has been experiencing and the pneumonia, they're all being aggravated by the hydrogen sulfide exposure and the poor air quality. So as a parent, and obviously I'm pretty sure a lot of parents in this community do feel the same way, they should not be wondering if the air quality or the air outside is making their child sick or sicker. I've also been talking to parents and like myself, families have been forced to close their windows, stay indoors, purchase air purifiers, or request one through the county, or have to wait for one of the free ones through the county. These purifiers are not cheap, they're very expensive. And avoiding outdoor activities. I myself have stopped going to the beach. I used to run a lot on the beach. I'm a very active person. And so that's affected me personally. I'm pretty sure a lot of families are experiencing the same thing. And it all has to do with the air, the quality, the poor air quality, and the polluted water. As you know, and at the same time, we still want to experience the beach, and be able to go and show our kids and have some fun. So that has forced me to go up to Torrey Pines and make that drive, so that my family could safely enjoy the beach and breathe cleaner air. And and on top of that, many families they cannot afford these extra costs to, like, for example, buying an air purifier or increase, higher utility bills because they have to run their purifier almost every single day. And for myself, having to take days off, having to, because of my child getting sick, I mean, at least I can do that. There's a lot of families that can't because of financial reasons, right? Or increased medical costs because they're having to take their child to the urgent care or to the doctor, or having to get an asthma inhaler or an inhaler for asthma because they're newly diagnosed with asthma. So these are the impacts that we're seeing in our community. Experiencing them myself. And I'm also hearing a lot of families saying these things are happening to them as well. And so I've seen over the last couple of years, the communication when it came to, the warning notifications, they were not implemented until the last, I want to say, the last year. This district has been following through with following the guidance, following the notifications, but at the same time, these notifications are being sent out after the fact, after we were a lot of times it's in the morning, really early in the morning. And we're getting ready for school, we're getting ready for work, we're not checking our phones, we're not checking our emails. So we're walking straight into this air immediately after we come out of our homes. So, and then as I speak with other families, I have a lot, as a school nurse, I'm always talking to parents, I'm always talking to the students. A lot of times the families, they're not very aware that there's these alert systems like the Alert San Diego, or the where they can enroll online and get the alerts through their emails or their text messaging. And so there's like that lack of communication, that gap. And at the same time, we have a majority of our parents are Spanish speakers. So again, there's that language barrier. Our communities, our community deserves clean air. We need transparent communication about our air quality so that parents can make that informed decision to protect their child from being exposed. And so I had this other conversation too with some family members and some friends that live in the community, and I've asked them, like, would this level of toxic pollution, would it be accepted in other communities like Santa Barbara, Monterey, Santa Cruz? I don't think so. And so, our children, they deserve the same protection, the same type of urgency, and clean air as every other community. So in closing, I believe that obviously we're experiencing a environmental crisis, but we are also experiencing a very serious public health crisis that is affecting our families, our children, and our schools. Our community, we deserve accountability, transparency, and long-term solutions. And clean air, it should not depend on your zip code. Healthy children are better learners. They're going to become like, there are leaders, there are future leaders. And so our governmental leadership, we need to take this very serious. Thank you.
Thank you so much.
Thank you, Virginia. Really appreciate you sharing the story of your school, your community, and importantly, your own family and what you're experiencing in your own household with your daughter's asthma and pneumonia. We're all thinking of you. We're all in allyship to find sustainable solutions to the pollution crisis. And so much of it starts with understanding it, right? The science behind it, evidence, and that is coming together more now than ever before, largely thanks to the research that both Dr. Prather's team and Dr. Granado's team continue to do in the river valley. It was only a short while ago that they were able to name the high levels of the hydrogen sulfide and name why so many community members have been plagued by these health impacts: headaches, asthma, pneumonia, gastrointestinal issues. And now we know. We know that it's real and we have the science to back it up. So it's time to act. It's time to act locally and statewide. But to continue to provide critical care to the impacted communities, we also need to have expedited support and assistance and understand the impacts that these environmental conditions are having on kids and families. And Dr. V. Nguyen is really taking charge of that in San Diego County. Dr. V has been an advocate for the environmental and health conditions in the Tijuana River Valley for several years now. She's a huge proponent of physicians asking their patients what their zip code is to help with the stronger linkage between their symptoms and chronic health issues and where they're living, going to school, working, if that's in the Tijuana River Valley. So, even more empirical evidence. And with that, I'll turn it over to Dr. V.
Hello. Can you hear me or?
We hear you.
Okay, great. I'm so grateful to be invited to come speak. My name is V. Nguyen. I'm a general pediatrician. I work as a community pediatrician, born and raised in the South Bay. I went to Bonita, Allen School, and practiced pretty much where we all grew up. The reason I got involved was that I started seeing the health effects of the hydrogen sulfide on my patients directly. I was the one who wrote the original letter that sent to the governor and the county board about my concerns. It was a letter from 25 community pediatricians in the South Bay that were seeing the same thing. And now we have a network of hundreds of pediatricians and family practice doctors and internists and healthcare providers throughout every single health system, including UCSD, the medical school, AAP, ACP, who are all concerned. And so, what I can tell you is that hydrogen sulfide, yes, it definitely affects asthma, pneumonia. That's what we see a lot of today. Just being a community pediatrician, I've seen the effects today. But when we talk about, when we teach medical students, we often remind them and residents to think systematically, and we tell people to present patients by systems. And I can tell you there's not one system that is not affected by hydrogen sulfide and the other pollutants from the Tijuana sewage. So you go from top to bottom in terms of the brain, neurology. We have headaches. I'm worried about developmental delay. ENT, ear, nose, and throat. You have kids with sinusitis, ear infections, lots of allergic rhinitis. In terms of dermatological system, the skin, lots of rashes and GI system. We think a lot of diarrhea, kids coming back from being exposed to the aerosolized bacteria and viruses. And then in terms of the kidney, worried about water quality. And I've definitely seen an odd uptick of weirdly E. coli resistant bacteria that were causing UTIs in some of my teenage girls. So just something like it's kind of been curious about and just think it's odd. So the health crisis is here. I'm seeing the effects of it. And I can tell you, I'm so proud of San Diego because we are coordinated. The whole healthcare system here, across all the healthcare groups, across the university, academic, we have tried to do as much as we can. And it's just not fair. San Diego will not be left behind. The South Bay cannot be forgotten. My patients, especially the little ones in Imperial Beach, San Ysidro, Nestor, Berry Elementary, they deserve better. And so that's why I'm here and continue to show up as a community pediatrician. And that really the state of California and the rest of our Californians need to not forget us. And it's just not fair to my patients. And so, and a recent report came out from the American Lung Association showing that we have one of the worst air qualities in the United States in San Diego, and certainly the hydrogen sulfide is not helping. So I'm proud to be here to work with all these amazing community advocates and groups. And I can tell you that I am just one of many doctors who is concerned, and I happen to be able to show up today because I finished clinic on time. So thank you so much, and I'm so grateful that I was given some space to speak up, and I hope everyone else does their part and does not forget us in San Diego and my patients.
Thank you so, so much, Dr. V. And yes, we're at a place where we're all speaking up now. This is a part of the wave of advocacy that needs to happen to find sustainable solutions and funding and pass progressive policy on this on a federal, state, and local level. And truly, San Diego aspires to be in the top 5 of many things. Tourist destinations, you know, best beaches perhaps, but to be in the top 5 of the worst air quality is shameful. And there's certainly more that can be done to address this. And that's exactly what's happening on a statewide policy platform that the Tijuana River Coalition is supporting. We are going to speak about a couple of the prioritized bills and appropriations and funding asks that the Tijuana River Coalition has supported and is actively working on with the authors and sponsors in the legislature, as well as Governor Newsom. If you have questions about what you've heard thus far or questions about the policies that we speak briefly about, please feel free to put them into the Q&A down below. We will get to a point in our agenda where we take questions and we'll welcome our subject matter experts to answer those questions in detail and or follow up with you with more information and more research based on your inquiry. So from what we've heard from both Virginia and Dr. V, you know, the impacts of hydrogen sulfide are real, and we know more about this than ever before. However, when the scientific evidence started to come forth about hydrogen sulfide levels and their impact, it was extremely hard to move on states of emergency, on rapid policy solutions, and rapid assistance to household, including air purifiers. Perhaps not just one, but 3 in a single family home, in all the bedrooms. And so that timeline is really a result of not having standards for hydrogen sulfide at a community level. Something that I learned from Dr. Granados and Dr. Prather as they were cultivating this empirical evidence was the fact that the hydrogen sulfide levels and measurements only really existed in California for animal feed production plants. There were only OSHA standards tied to labor, but nothing for community-based issues because it shouldn't be found in communities. Based on the EPA standards and the levels that California has set for those OSHA standards, we're measuring extremely high parts per billion, some of which have registered the highest in just this March and April of 2026. The flows continue, and the air is still more toxic than ever before. So State Senator Steve Padilla is doing something really critical to address this. He has Senate Bill 58, which works to establish greater levels and parameters, protocols around high hydrogen sulfide levels in communities. It's extremely important for Nestor, San Ysidro, Imperial Beach, and even Coronado as impacted communities because it gives us more evidence and policy backing to get these communities support. We want to thank our partners at the Air Pollution Control District as well as CARB, who have both influenced this bill and will help with the important implementation once it's signed by the governor. But we need everybody to raise this bill as a priority and help get it passed so that we can continue to make progress on this important issue. State Senator Padilla and Senator Blakespear also have Senate Bill 1046. And going back to OSHA standards, we have a number of workers spanning from lifeguards to park rangers who are having to work within these unsafe environmental conditions on a daily basis. So SB 1046 looks to set new safety standards and protect workers near the river valley and those who are exposed to pollution. I want to thank the two senators for their incredible efforts to continue to pass legislation and ease the burden of the pollution crisis. State Assembly member David Alvarez has also been a real champion on this issue since joining the legislature. He's worked tirelessly to combat the issue and passed an expedited bill, AB 35, which is efficiently releasing Proposition 4 funding for a number of projects in the River Valley. So we're so grateful for their leadership. They're also carrying a number of budget asks, and continued funding for the plans and projects tied to the pollution crisis are critical. We need this on a federal, state, and local level because the projects are vast. They span both the US and Mexico side of the border. We have plans. We know how to address this crisis, but it takes resources to get it done. So this state legislative cycle, we really want to see a number of funding requests granted. That includes, again, the release of the Proposition 4 funding to expedite a number of projects. We're also requesting up to $23 million in rehabilitation of local transportation infrastructure in the River Valley, and that includes mitigating the hotspot. And for those of you who are here and may be new to the issue, the hotspot can be found on Saturn Boulevard in the Tijuana River Valley. You know it when you find it because it stinks. Some folks historically have called the smell a nuisance. If you're at the hotspot, you know you're in a public health crisis. Folks who work in the area, folks who live, go to school in the area, live with this on a constant basis. They can't open their windows at night. They can't exercise in the morning. They can't play at recess because of the smells emanating from the hotspot, the exposure to numerous illicit chemicals. And so the funding to re-engineer the hotspot is critical. That is a short-term project and it needs significant resources. We also need to continue the Air Pollution Control District's area program. This has been funded locally for the last year, and it has ensured that community members have access to no-cost, high-quality air purifiers. With the recommendation from researchers and scientists, these air purifiers are the only protections really that households have from inhaling these toxins while they're in their households, while they're sleeping. That program has recently expanded, but it is minimally funded. We need sustainable funding, and we need significantly more to make sure that households are equipped in all the bedrooms. Not just one per household, but three. Sometimes we have, 3 generations under one roof in these impacted areas. We need sustainable access to these air purifiers. And so $5 million request for the Community Air Protection Program is also an item that the Tijuana River Coalition is actively supporting. And finally, one of the critical pieces of infrastructure that has made a big difference in the trash that finds its way into the IBWC and often stalls or breaks some of the mechanical infrastructure is a trash boom. And this technology has been a phenomenal asset to the River Valley. It is engineered to cross the river, and it collects a lot of the items ranging from debris and significant sediment to larger items. And that is all collected on a regular basis and properly disposed of. But the pilot project for the most critical trash boom is coming to an end. So a $2 million request to continue the trash boom project is something that has to be passed this year. So again, we are thankful for our state legislative champions, including State Senator Padillas, Blakespear, and Assemblymember Alvarez, for really pushing for these appropriation asks and their bills. Assemblymember Berner has also been a real champion on making sure that her North Coastal communities know that they're also impacted by this issue. It's one ocean, one community. We all have a responsibility and a role to play in it. And we've seen more support and an authentic commitment from the County of San Diego in the last year. The Tijuana River Coalition is proud to call the County of San Diego a partner in this important work. Multiple departments, including our friends at Park and Rec, importantly, Public Health, the Engineering Department, Economic Development, and importantly, Supervisor Aguirre, have all been partners in this important work. They're all showing up locally, and it's important that the state and feds meet us in this effort. So now I'd like to turn it over to Supervisor Aguirre's Senior Policy Advisor on this critical issue, Stephanie Siquin. I'll turn it over to you.
Thank you. Good afternoon, everyone. I want to, on behalf of Supervisor Gary, extend her, kind of thoughts of not being able to be here. She had something urgent come up. She's perfectly fine. So you guys have to just deal with me. You don't get the superstar that we all have admired. She's amazing. So let me just give you a super quick background on what she has been doing and has been doing for decades. Most of you know her from her previous roots working for Wild Coast as an environmental advocate. This is where she first turned on to this issue over 20 years ago. She was with Wild Coast for a while. She got so fed up with it, she ran for city council at Imperial Beach, was elected there, served some terms, got elevated in her leadership to the mayor, and then recently ran for the special election for the Board of Supervisors and won in a great way to continue her championing of this issue. I've been working as her senior special advisor for 7 months or something, and I'm running and catching up to get on her coattails. This woman is unstoppable. I am not saying that just because she's my boss, but to see an elected official take this so seriously and to work literally before she was even sworn in, hitting the ground to work with Courtney was talking about. So there's several agencies that are in partnerships here, and I don't want to belabor too much, but I just kind of want to fill in a couple little spaces of what the county's doing in terms of Saturn Boulevard. So I just put in the chat a link we have to a fact sheet for Saturn and what we're doing there. The county had done a study, a feasibility study, looking at 5 different options. There's 2 that stand out, which are enumerated in that fact sheet right there. The first is the temporary pipe extension. The county is putting, skin in the game, lack of a better analogy. We just passed at the board level $2.5 million to do that temporary pipe extension. But as Courtney had mentioned, there's really a long-term need to acquire up to $25 million to do what we call as the box culvert bridge, which is the long-term solution, which is identified again in this feasibility study that the county had put together. Again, want to highlight the counties of the APCD, the public health. Yes, there's been a lot of spikes of hydrogen sulfide. And, even though I work for Supervisor Gary, I'm very in touch with the county. And I'm not going to lie, there were some gaps in communication when the hydrogen sulfide areas would spike. That's a multifaceted thing. That doesn't just go to the APCD. There's many agencies and entities on both sides of the border that there might be a spill there. It might take a while for Mexico to notify us. It could take a while for things to trickle down. So the county, I'm so proud of them, especially the Department of Health and APCD. They worked to improve those mechanisms. So instead of, as Nurse Virginia had mentioned, they were getting updates at 8 o'clock in the morning. That's not sufficient. When you're walking to school, you don't want to get a text update that your child's breathing in hydrogen sulfide. So our office worked with the county to ensure that they were going to have folks up, and this is in the past couple weeks, maybe month, where they're having folks get up at 5 o'clock in the morning and sending out alerts. They're notifying the news outlets. They're staying in the office until 10 o'clock to send out these. So they're trying to catch up, which again, there's multi-layers of communication and just really ensure we're doing what we can at the local level. APCD has been helping us with the air purifiers. There's 40,000 individuals that live in this area that are breathing in toxic chemicals. And as all the other panelists have said, it's not just sewage, it's industrial waste, it's banned pesticides, it's illicit drugs. It is a slew of things that our folks are breathing in down there. So we're very grateful to the APCD for starting this air purifying program. We've handed out 40,000 air purifiers thus far. 12. I wish it was 40,000. 40,000 is the number we need. We've handed out 12 and we've been fundraising. Again, the county just passed $4 million to go towards the budget for 2026 to get additional air purifiers. But that's why we need the other budget request that Courtney had mentioned, is to glean another 5 million from the state so we can make that program whole. But that's just for 2026. And that's just for one purifier. The California Department of Public Health suggests 3 to 5 per home. A lot of folks in our community are multi-generational, where they have literally, I have stories, y'all, of people lugging around the air purifiers, flipping coins on who gets to get it at night. Just anecdotally, I want to share a couple stories from our constituents and even folks that I work with on the daily basis. Right now, my executive assistant to the supervisor, she has an ear infection. And Dr. V just mentioned that. And there's constantly folks in our office getting sick. Their children are being traumatized by this. Another coworker has a 15-year-old daughter. So do I. She had left her window open one day, had closed her door, so the hydrogen sulfide was trapped into her room. Her mother said, please don't go back in there. And if you do, keep your door open, keep your window open. What 15-year-old girl keeps her door open? No one. And I know that for sure. And she came running out going, just tears, red eyes for 2 days. But mostly it was an emotional reaction to her that she didn't feel safe in her own room. Now, I don't want to delve too much in. We have a lot of questions we want to go through, but I'd be remiss if I didn't double down on the environmental justice component of it. And this is what Virginia was saying at the top of this. You know, there's so many different communities that if this was happening, it would absolutely have been solved by now. And unfortunately, we're making a lot of great strides right now, but it's because the problem has gotten so bad that people are rattled. They've woken up, whether that's from the county all the way to the Trump administration. Now we have this chorus of people trying to work on it. And again, it's at that point because it's so bad. So, but going back to some positive things that we are, yes, you can post that if you want. Another couple positive notes from the county, and then I will turn it over to the rest of us so we can have a good conversation. We've commissioned to do epidemiological studies so we can look at retroactively what people have been exposed to, whether that's hair samples, blood samples, tissues, anything to see what has been, as Dr. V was saying, what is in the bodies of these individuals who live there. So the counties, again, put some more money towards that. As Courtney mentioned, we're doing our economic study. It's a 2-year study. It's really important. The previous one we did was kind of self-reporting. It was, I think, done in a week or two. This is going to go through everything for 2 years, seeing how many kids miss school. What did that do for school funding? What about property values? Everything else that Courtney had mentioned as well. And then we're also looking at doing soil testing. So there's a slew of great things. We're very excited to be working with our colleagues up in Sacramento and going next week actually to ensure that we can get that $23 million to do the full-time upgrades at Saturn and to get some purifiers into our community. We continue to advocate for Prop 4 funds, which again, there's a lot of different activities and programs that would benefit from those funds. And then we continue to call on every level, whether that's county, state, and federal, to implement states of emergencies. The county has already instituted 22 states of emergencies over the past several years. And the reason why those emergencies are important, and we can see it at the county, is that theoretically every state of emergency language is written very similarly in terms of legal terms. It's a large, broad discretion. It is up to the leader, whether that be the president, the governor, or the board of supervisors, or the mayor of a city, to be able to say, okay, three things, very simple, three things. I identify a problem that's happening that's an emergency. It is typically a fire. Guess what? Air pollution is the first thing that's listed in a definition of emergency. Check that one off. Second one, are there projects that can be sped up through two different mechanisms? One, permitting. Sometimes, as you know, California's got great environmental law. I've been working my whole life on making permits stronger. But when there's a crisis like this, we really need to speed up how those processes go with the permits. Finally, and this is more of like a state public resource code 8625 for the state of California, says the governor shall identify agencies to work on this issue, direct them to implement specific activities that will improve the solution. Secondly, expedite permitting. And third is to tell the agencies to use funds to solve this problem, regardless of how those funds were originally appropriated. So I think it's important that, this doesn't come from a big, huge general fund ask. It comes from different agencies who can be looking into the solution. And then the same thing is very similar at the federal level. And we've been talking to the Trump administration and the Biden administration, for that matter, to see if we can get something similar at the federal level. At this point, the problem has commenced into such a crisis that we do need these declarations again at the local, state, and federal level. Once we get that, we'll have our permits working together. We'll have finances unlocked a little bit easier. And also, I think really, and my final note here is it helps the locals understand that people are paying attention. People feel very left behind right now because this problem has been going on really for over 50 years. It goes back to the end of World War II and how the treaties were set up between the two countries. In hindsight is hindsight. But I think, all the efforts we're talking about today, which are so wonderful, and Senator Padilla, Assembly Alvarez, Senator Blackspear. I mean, these folks have been working with our office to get these requests into the legislature. So we see so much movement at the state level. It's honestly, I have chills from it right now. We're so grateful and gracious to the help that we're now getting at the local level. And again, thank you to the Tijuana River Valley Coalition for all the work you've done and continue to do. I'm sure I missed something, so I'll look at my notes and scoot back by, but I think I'm at my time limit. So I'll hand it back to Courtney.
Great. Thank you so much, Stephanie. And we appreciate you joining us. And we are also sending good wishes to Supervisor Aguirre. Also wanted to recognize that our Assembly member, David Alvarez, and our State Senator, Steve Padilla, were not able to join us today, but wanting to join us. And so we wanted to just assure folks that if there are questions for those policymakers, please direct them now. And, now's the time to ask them, and we'll make sure that we follow up after this webinar with appropriate answers. I also wanted to mention that the fact sheet about county solutions that Stephanie spoke about will be shared as well after the webinar, along with recording and some petitions that are calling for greater action, including a petition that Supervisor Aguirre's office has set up calling for a state of emergency declaration from the California governor. And with that, I'd like to transition into questions. I see a first question from Rita Schmidt-Sudman. So I'm going to unmute Rita and allow her to ask her question to the panelists. And also, if other folks have questions, please feel free to either use the raise your hand function on Zoom if you know how to do that, or the Q&A typing function, which is enabled unlike the chat. So thank you all for bearing with us, and we want to open it up and encourage members of the media and members of our community to please ask questions. So Rita, I am unmuting you if you'd like to ask a question. Go ahead, Rita.
A couple of the candidates for governor have said they would declare a state emergency. Governor Newsom has not been willing to do so, not because of sympathy, but apparently he says because of money. What would, how much would it really help, and what would really happen if the governor took this step, which they have not been willing, he has not been willing to do, but a couple of the candidates for governors now say they would.
Yeah, I was going to ask Courtney to take that question, please.
Yeah, it's a great question. And thanks again to Supervisor Aguirre's leadership. She has extended invitations to all the gubernatorial candidates. A number of them have been down. Thank you, Stephanie, for helping to host many of them. And there's a spectrum of who is willing to commit to a state of emergency or not. Um, Steph, from your perspective, what would be first next steps when and if a governor declared that state of emergency? We know a lot of resources would be unlocked, and it would also be a signal to the federal government to do a similar state of emergency, correct?
Correct. Yeah. And I'm certainly not going to speak on behalf of the governor. He has expressed obvious sympathy for this situation because it's so egregious. So we're thankful for his awareness. And I think it's twofold to your question. Yes, money has been mentioned, but as I mentioned, when you go through the public resource code, there's agencies that can dip into their own budgets to help with monies. So that could be mitigated. It wouldn't be like lock, stock, and barrel on the general funds. And he recently had said something in the news, which he's really saying this is, whether you believe it or not, or agree with it or not, or want to hear it or not, that it is more of like a federal and international issue. And so he's really deferring to Mexico and America to come together to work on the solutions and prioritize that. That is absolute his prerogative as governor to do what he wants to do. But Courtney, to your more specific, and I kind of mentioned it before, again, it would help with those permits, it would get agency money, and it would essentially help these projects go quicker. So for right now, for Saturn Boulevard, if we were to have an emergency, now let's just say I snap my hands, we have an emergency. What could happen? We literally could work with our Department of Public Works, which we've already been in. Want to give a quick update about that later. We've made a lot of headway in terms of designing, construction, permitting, what that would look like. I mean, as flippant as it sounds, our public works could go down there with a shovel tomorrow and start implementing the designs that we're currently creating. And what we would do is we'd go retroactively back to these agencies to get permits. So instead of having to wait for your permit to put a shovel in the ground, you can go ahead and expedite the project. So that would be the first thing for Saturn. We already have the $2.5 million that's been put up for this temporary solution. So we don't need funding. We need zero funding from anyone at this point. The county's already provided that. So all we do need is the expedition of permits and all these state agencies coming together, working in an interagency connective way. And that would be extremely helpful. And that's just for the temporary pipe extension, which again, we already have the designs and the money for. The long-term solutions, if we can get that, we would advocate for the governor and other agencies to say, okay, let's release all of Prop 4 funds that are to go to the river, on the border area. Let's do all of that right now. So that would speed up more money again that doesn't come from the general fund. So there's a way around the money issue. And we've already started to solve that at the county by passing the $2.5 million. And it just kind of goes like that. I mean, I don't want to oversimplify it, but it is that clear. We could hit the ground running. We could absolutely put a shovel in the ground tomorrow and retroactively get our permits and have resources, financial and moral support from the state, the governor, different agencies within California.
Excellent. Thank you for that. Thanks for the question, Rita. I appreciate it. Next, I'm going to recognize Deborah Brennan, who has a question in the chat that's very brief. We appreciate it. So I'll just read it aloud and I'll also unmute you if you want to add anything, Deborah. Can you please give an update on state legislation? And the best person to do that, I believe, is Sarah Davidson with the Surfrider Foundation, which is also an anchor of the Tijuana River Coalition.
Yeah, I guess I just wanted to elaborate that I know that Senator Padilla has introduced or discussed a number of legislative possibilities to change the state standard for hydrogen sulfide, as well as to perhaps hold U.S. California companies responsible for pollution they produce on the other side of the border. And there may be other legislation in the works as well. So I just wanted to get kind of a rundown on what's been introduced and where it's at, how much support it has, and how far along it is in the legislative process.
I also want to flag too, we have Artemis on the, sorry, Artemis, if I have to put you on the spot, but you are one of the sharpest women I know about where things are. And I hope she's still here, but she's running around the Capitol every day with these pieces of legislation. So Artemis, I'm not sure if you're on, but chime in if you want.
No, I think she had to jump.
Yep.
Yeah, we can tackle that. I know that Tiffany Curry has also been closely following all of these bills and appropriations asks. I think that there is robust support. The two Senate bills did have unanimous support and made it out of House of Origin. So now we are working across Assembly members to make sure that there is equal and evident support so that they make it to the governor's desk in upcoming months. For the appropriations ask, the May revise has everybody holding our breath. The good news is there is one additional piece of or priority funding ask, excuse me, that is already in the governor's budget. So this is for 4 regional water board staff positions specific to the Tijuana River Valley. Those were in the governor's January budget. We are looking forward to seeing those again in the May revise. I neglected to mention those 4 positions earlier, but very grateful to the governor for including them early in the session. For the other appropriations ask, we think that there's a real chance, largely because, of the awareness of this critical issue. But happy to follow up with folks, including you, Deborah, as we work through the May revise and the end of the session.
Excellent. Thank you all so much. All right. Next question is from Jazz Taylor. And Jazz, I'm going to go ahead and unmute and let you speak on your question. Thanks for it.
Thank you. I just wanted to thank you all for the amazing work you're doing locally, but also the larger connection, both state and federally. But we know how important the outdoors is with Latino Outdoors. I'm the national policy advocate, and we have members who live in the community, work in the community, teach in the community, and hearing time and time again the impacts on them. And we know how the important the outdoors are for our community members, including connection to the outdoors, whether that's celebration events, recreation, cultural events, commuting to and from places, but just everyday life. As we continue to navigate the ongoing air quality concerns related to the Tijuana River, what are some recommendations that you have for residents trying to still balance it immediately right now, staying engaged in the outdoors while also protecting their health? We've seen during COVID how important the outdoors is just for our mental health, nonetheless, community connection. And so we know that we need long-term practical solutions, but what is something more immediate that folks can do to be able to balance this?
I would love if Dr. Nguyen or Ms. Castellanos wanted to take that as health experts, if you feel comfortable sharing. Thank you for that wonderful and important question, Jazz.
Yeah, thank you so much. That's such a good question, right? Because, kids need to play and adults need to play as well and to be outdoors. And I mean, cutting off a complete coastline to a community is very painful and hurtful. So, we, through the American Academy of Pediatrics, we're working with the San Diego Natural History Museum. I do a lot of the stuff with the Bird Alliance as well. And so there are other outdoor spaces that, don't replace the coastline, but we should get our kids out there, right? Bird watching, hiking, to stay connected. So what I would say is what we're trying to do, I'm just personally trying to do is gather those resources, make them available, continue to advocate together with outdoor and all the different coalitions trying to get kids outdoors. And I think part of our job as healthcare professionals is to raise the awareness that this is physically affecting kids in terms of metabolic diseases, type 2 diabetes. I see a lot of fatty liver. It's so much fatty liver disease. And even just the psychiatric anxiety part of not being outdoors. But I think bringing awareness, being connected together, and making sure that we welcome everyone to the different outdoor spaces that are available in San Diego, because we are the most biodiverse county in the country. I think we're all very proud of that. So that's what I'm trying to do. And I think the nurses, like Virginia, are so key in terms of publicizing and kind of mitigating these issues.
Excellent. Yes. All right. Well, I really appreciate everyone's responses and really, focusing today on this really important issue and so many lists of policies, but they're all important. And really, again, the focus, I think, this week being on Sacramento and how the state of California can lead and help make a big difference in this issue. Before we run out of time, I wanted to be sure to share a really beautiful aspect of this crisis and also the solutions that are at hand, which are from our communities. It's a visual presentation, and all of these photographs and pieces will be available upon request for any publications reporters who are on the line who would like to publish it after the fact. I wanted to take the opportunity to share this presentation and also to call out the voiceover, which is from a rancher in the Tijuana River Valley named Gabriel Uribe. And he's sharing his experience and how it's really been living and trying to maintain a business in this crisis. So, with our last 2 minutes, I want to thank everyone for being on. We will go a little bit past the hour, but I wanted to play this slideshow presenting some of the visuals and photographs and testimonials that the Tijuana River Coalition has shared. So, here we go.
My name is Gabriel Uribe, and I'm from the South Bay, San Diego area. I live currently here in the Tijuana River Valley. Well, this is where I used to live because I recently moved out due to some very toxic air. Hydrogen sulfide got to a point where, we had to use respirators. I had to sleep with all my windows sealed inside my little cabin there. And even like that, the stench would just find its way in. Then I was stuck inside a room. I didn't know whether to open up the windows and get the breeze of all the air or just fester in it. It definitely wakes me up. My body's telling me, go put on that respirator. Bought this land back in 2008, but I've been in it since 1993. This is where I grew up, and we used to come and ride at night, all night when the moon was full. When we had a full moon, it was the best time to go riding at night and enjoying the moonlight. Heading out to the beach and watch the grunion come up to the shoreline. Oh my God, those were the great old days. My peace has been destroyed. It's been affected. My animals are getting skinny, even though I do everything to keep them nice and healthy, as far as deworming them, giving them good alfalfa mixed with Bermuda, good diets that help them maintain a good size weight, and I just can't get them there. My animals, we have well water here. So it can be a combination of the air, the water, and all the things that come with the toxic chemicals. All of that beautiful, all of those great moments that you were used to living with, all of a sudden it's being threatened. It's being destroyed. The debris, the stench, everything has destroyed our beautiful parks here. Nobody deserves to deal with that. Nobody in our community.
All right. With that, I'm going to allow Courtney to close us out and thank everyone for joining today.
Thank you so much again to nonprofit and public partners who made the time today, our media allies. Please continue to share this story out. It is so, so critical. Importantly, we also want to recognize that we are advocating for and on the unceded tribal lands of the Kumeyaay Nation largely. I see we have some tribal representation here as well. Thank you, Lisa and partners who made the time. As a follow-up, friends and media allies, please share out the two petitions that we will put into the chat here. One is from the Surfrider Foundation, a renewed call for state of emergency. Also, the state of emergency petition from Supervisor Aguirre. Those are terrific calls to action to include in your social media or at the end of an article that you may publish about this briefing or a piece about the current status of the pollution crisis. Thank you again, and we realized we didn't get to everybody's question, so we will work to get back to you with detailed information, but you also have Rachel's contact information. Feel free to reach out with any questions or suggestions in partnership on how we keep doing this work together to end the pollution crisis in the Tijuana River Valley. Thank you.
Thank you very much, folks. We really appreciate the time. Hope everyone has a good day.